When a girl born, they already have immature eggs in their ovaries, and only when they attain puberty, those eggs become mature. When the matured egg is released, it will survive up to 24 hours. If sperm reaches the egg during this time, you may get pregnant.
Whenever an egg is released from the ovary, the uterus prepares itself for pregnancy. What happened is the uterine lining called endometrium becomes thicker in preparation for pregnancy. And if pregnancy is not happening, it will shed through vagina as menstruation. This is all about menstruation. Let's see phases of menstrual cycle in detail.
Menstruation, follicular phase, ovulation, and luteal phase are the phases of menstrual cycle. When menstruate, the uterus shed its lining and flows out through vagina. Menstrual blood contains blood, mucus, and cells from lining of uterus. Average duration of menstruation is 3 to 7 days. Menstrual cycle is measured from the first day of a period and to the first day of next period. Total duration of menstrual cycle is 28 to 29 days. But every woman's cycle is different. For example, teenagers might have cycle last 45 days and women in their 20 and 30s might have cycle of 21 to 38 days. First period is called menarche. Average age of attaining first period is 12 to 13. But some girls might have early period at the age of 9 and some girls might have late period at the age of 16. Last period is called menopause. An average age of attaining menopause is 51 to 52. But in some women, it may reach up to 60. So we have covered menstruation among the phases of menstrual cycle, that is a shedding out of blood along with lining of uterus and mucus. Next is follicular phase. Follicular phase. From the name itself, follicular phase is the development of follicles. How? At the age of puberty, hypothalamus will release gonadotropin releasing hormone and which stimulate the pituitary gland to secrete luteinizing hormone and follicular stimulating hormone. This follicular stimulating hormone helps in the development of follicles. Inside the follicles, actually egg is there, the egg is developing. So follicular stimulating hormone results in the development of follicles inside the ovary. These follicles can secrete estrogen. This estrogen is responsible for the development of secondary female sexual characteristics. So, development of follicles along with egg is happening in the follicular stage. In follicular phase from the follicle, estrogen is released and this estrogen is responsible for the development of breast tissue, stimulation of uterus, thickening of endometrium, and thinning of cervical mucus so that the sperm can enter through the vagina easily around the time of ovulation. These are all the responsibilities of this estrogen hormone. And estrogen can also do negative feedback towards hypothalamus as well as towards the pituitary gland. What is this negative feedback? We have seen the follicle is developed already. So, no need of FSH again. So, there should a decrease in the level of FSH. For this purpose, negative feedback is performed by estrogen hormone. Okay, as a result of this negative feedback, there is a dip in both LH and FSH. These two are the gonadotropins. So, as a result of this negative feedback, there is a dip in both LH and FSH. Okay, but we need LH for the purpose of ovulation. So for how it will happen? Just prior to ovulation, there is a dip in the estrogen level occurs, and this negative feedback is removed from the pituitary gland as well as from the hypothalamus. As a result of that, there is a increase in LH level occurs again, and this increase in the LH level will result in the release of egg, and it is called ovulation. This is ovulation phase, nothing but the release of egg. After ovulation, the follicles will become yellow colored substance called corpus luteum. This corpus luteum will release high amount of progesterone and less amount of estrogen. The progesterone will help in the maintenance of thickening of the endometrium, and it will act upon all the tissues in which estrogen acted previously. If pregnancy is happening, embryo will release HCG, and this HCG helps to make the corpus luteum alive, and it will continuously producing progesterone which will maintain the pregnancy. And if the pregnancy is not happening, there is no HCG, as a result of that the corpus luteum will die, and there is a dip in estrogen and progesterone will occur, and all the uterine lining in preparation for pregnancy will shed out through the vagina as menstruation. And this cycle is happening again and again. After menstruation, again from the hypothalamus gonadotropins are released, and the follicular phase, ovulation, luteal phase, and then menstruation is happening again and again. Thanks for watching. Please do like, comment, share and subscribe Knowledge Masters.